Good morning and thanks for waking up with us. Today's episode is all about Z's. We are sitting down with a registered sleep technologist from Wilson Health to discuss how sleep is so important to your overall health. You'll also hear from two patients who are willing to share their stories of how sleep disorders have affected their life and how with proper treatment they are now getting their best night's sleep to better health. Well, good morning and thank you so much for being here. I'm really excited about this morning's episode because it's all about sleep. And I'm excited to share some information on how important sleep is to your overall health. Talk a little bit about your role at Wilson Health.
I've been a respiratory therapist for almost 40 years. About 15, 16 years ago, I got into the world of sleep. Became registered somewhere around 2003. Been here at Wilson for 14 years now. Started out doing pediatric sleep medicine, which was extremely interesting. I knew nothing about sleep my first night that I went to observe a sleep study. And I was just absolutely amazed at what all is actually going on while you're sleeping. There's all the different sleep stages to watch, the heart, the breathing patterns, the leg movements, how much you toss and turn. All of that becomes very interesting when you start putting it all together with the brain waves and then the history of the patient.
So it really does, sleep does affect all aspects of a person, or can affect all aspects of a person's health.
Very much so. With children, if they don't go through the right sleep stages, it can affect the growth hormones. So you can have kids, especially the boys, that you notice that, become teenagers and they've yet to develop that deep voice or the facial hairs. And it's because that growth hormone can't get released if they don't go through those right segments of sleep. A lot of children wind up being misdiagnosed of having attention deficit disorder. A lot of kids, when they get tired, they become very hyperactive. So a lot of them actually have obstructive sleep apnea and they're on medications for ADHD. It also affects, as far as the adults, your cardiac is a big issue. We see a lot of atrial fibrillation, different types of arrhythmias. Obstructive sleep apnea is the most common. And with obstructive sleep apnea, what's happening is the throat in the back of your throat is narrowing down, cutting off the airflow into your lungs, so you're losing oxygen. The brain senses all of that and kind of wakes you back up again. You only wake up for a split second to take a nice deep breath, but then you go back to sleep and you start doing it all over again. So it's just a real repetitive sequence that's taking place throughout the night. You can see like narcolepsy. Narcolepsy is where a person doesn't have obstructive sleep apnea, but they fall asleep very, very easily throughout the day. So we also test for that, and that's probably the second most common that we see. On top of obstructive sleep apnea and the narcolepsy, there's patients that have central sleep apnea, and that's where the brain isn't even sending the signal to the body to take the breath. That is seen a lot in cardiac patients and also in drug abuse.
I have to ask this question, snoring. I know we experience it in our household. If somebody snores, is that an indicator for a sleep disorder?
Very much so. The sound of that snoring is the sound of the air trying to get through that narrowed down airway.
Okay. You mentioned children and their sleeping habits. Do you provide services for the pediatric population?
Yes, we do. We do children from the age of 6 all the way up.
And you're able to diagnose and treat those patients right there at Wilson Sleep Center?
Yes.
Not every person's situation is the same. So, there are some people out there that don't have a sleep disorder, but they're just not getting enough hours of sleep and enough hours of rest. Can you share some tips on how can we get our best night's sleep?
Well, to get your best night's sleep, one, you need to make enough time to get sleep. And in our busy world, not just adults, but in the children also, an adult needs at least 7 hours of sleep. And they say the average adult is only getting 5 to 6 hours of sleep. So we need at least 7. Some of us need 8 or 9 hours of sleep. The teens actually have an increased need of sleep. They kind of decrease a little bit around that 10 to 11 range, but then when they hit their teens again, they're back up to that 9 to 12 hours of sleep. So on Saturday and Sundays, when they're wanting to sleep in, it's because they've been sleep deprived most of the week. And then the grade school age children, they need to have 10 to 12 hours of sleep.
In terms of routine, I've heard that it's good to have a routine when it comes to your sleep.
Very much so. That routine helps the brain to start processing that it is now bedtime. It's time to relax. Some of the things that you should do, and we all pretty much did them for our children when they was young, is you give them that nice warm bath. That's just a thing that helps us to start relaxing. It drops our body temperature just a little bit. And our brain then says, okay, it's time for bed. Start decluttering your mind of all those busy things that went on during the day. At 8, 9 o'clock at night, don't start planning for tomorrow. Let your brain just kind of relax and prepare for bed. You want to turn electronics off at least an hour before your bedtime. It's real important to keep a routine 7 days a week. So on Friday and Saturday night, you don't stay up until 12, 1 o'clock in the morning. You still go to bed at your normal bedtime, whether it's 9 or 10. I can remember my parents and my grandparents all saying early to bed, early to rise makes a man healthy, wealthy, and wise. That's true. We need to try to follow that normal circadian rhythm. When it starts getting dark out, we start preparing for bed, we start relaxing, and we get up when the sun comes up, because that helps our bodies to prepare for that. We're secreting a hormone called melatonin, and it's regulated by the daytime sunshine and the nighttime.
So we are going to talk with a couple patients of Wilson Health Sleep Center here in a few minutes, and I think you know both of these individuals. You see a lot of patients that come through Wilson Sleep Center, and can you talk a little bit about some of the experiences that you've seen in patients that have had a sleep study, had the treatment, and how their lives have changed?
To get them into the sleep center initially is the push of a wife or a spouse, because of the snoring. The snoring is keeping them awake. They get worried about seeing them pausing, during the night where they're not breathing at all. Getting them into the sleep center is the biggest step, which is going to your doctor and getting that order sent in for us. A lot of people come in with like they're afraid, because they don't know what to expect. They envision the old-time movie where somebody's sitting in a window staring at you while you're sleeping all night. And it's not that way at all. The rooms are set up like hotel rooms, so they're very comfortable. They're queen-size beds, recliners, TV, and a full bathroom in every room.
Talk a little bit about the results that you've seen in your patients.
Once the patients come in, we get them hooked up for their studies and everything. The technicians are sitting there throughout the night watching the computer screen. Each page that goes across the screen is 30 seconds of time. On the average night, we have 720 to 1,000 pages of information that we're looking at. We have patients that stop breathing. They can stop breathing, every 30 to 40 seconds. Some of those are very severe. To be considered positive for obstructive sleep apnea, you have to have 5 events per hour where your airway's closing off. We've had patients that have had 105 times an hour.
Knowing that, and then, being on the other side as well, where you're able to help these individuals. Talk about what that means to you to see where they were prior to the diagnosis, and then, able to treat them. How has that been for you?
It's a very rewarding experience. That's why I'm still doing sleep today, because you take somebody like that, and you're not just fixing the patient, but you're also fixing that family, because the spouse is usually sleeping in another bedroom, or they're sleep deprived, or the kids are saying they can hear dad snoring through the walls. We've seen so many patients that their sugar levels, they're diabetic, and they've not been able to get their sugar levels under control. So once they get put on CPAP, and they're getting that restful, restorative sleep, their sugar levels start leveling out, so they're not using as much insulin and stuff. A lot of heart problems, we see those resolve. A lot of the patients with AFib, a lot of times those will resolve once those respiratory events are taken care of.
That's amazing. I mean, just how important it is, how important sleep is to your overall health. And that's really one of the main reasons we wanted to do this episode, was to kind of make that connection with our viewers, that if they think, that they have a sleeping disorder, to talk to their doctor. And that was going to be my next question, is what's the first step people can take if they want to have a sleep test?
They need to make an appointment with their doctor. They can do it with their family doctor. They can go through a cardiologist. They can come and see our sleep specialist. Any doctor can refer them for a sleep study.
Okay. We know it's important. We know sleep is important to your physical health. Can we talk a little bit about how important it is to your mental health?
There's a lot of studies being done right now that your different mood disorders, your bipolars, your anxiety and depressions, and also your Alzheimer's patients, that obstructive sleep apnea plays vital roles in those. They're doing studies of the brain right now where it's showing that the Alzheimer's part that is affected the most by the lack of oxygen may be the key factor in preventing Alzheimer's.
Thank you so much for being with us this morning. Would you take a few minutes and share your sleep story with our viewers?
Hi, I'm Jeff McAtee, and this is my sleep story. I've been on CPAP and had sleep apnea diagnosed since 2003. My wife and I were driving to Lima one time, and I fell asleep at the wheel. And she said, "You have to go to the doctor because there's something wrong with you." And so I went to the doctor, and he recommended a sleep study, and we went over to Wilson, and I did my sleep study all the way back in 2003, and I was diagnosed with severe sleep apnea. Some of my symptoms were that I was just tired and sleeping all the time. I could fall asleep at a drop of a hat, anywhere. Give me 5 minutes, I would just fall asleep. But I'd never rested. During that first night, because my sleep apnea was so bad, they went ahead and hooked me up to a CPAP machine that night because I scared the technician so much. And from that time when he did it, even my blood pressure just dropped like 30 points in 4 hours. They say that if I hadn't started CPAP and started using my CPAP all the time, that I probably would have had a stroke by now. Wow.
How has your life changed, since that diagnosis? And obviously you rely on the CPAP machine. How has your life changed?
I have enjoyment again. I can stay awake for more than 4 hours at a time during the day. I have better job reviews. My wife sleeps better. She didn't realize how bad she was sleeping because how badly I was sleeping. Mm-hmm. But then after I got the machine, she was going like, "Wow, I feel so rested now. It's just amazing."
Wow, that's great. That's great. So Jeff, tell me a little bit about some of the health issues that you were experiencing.
Most of my health issues I didn't realize were because of it, but I was always fatigued. I had a lot of headaches. I had high blood pressure, just all these different things that led to just not a very comfortable existence, but one that I was used to.
Mm-hmm. Well, thank you so much for being with us this morning. Can you take a few minutes and share your sleep story?
Well, my story probably began about 15, 20 years ago. Wife was really concerned because I would quit breathing. So she would lie in bed and wait for me to start breathing again. So it really concerned her, and she suggested that I talk to my doctor about that. So I went to my doctor and described what I was doing at night, that I was having headaches in the morning. Probably about 2 o'clock, I would think of nothing but my bed at 2 o'clock in the afternoon, nothing else but my bed. So he suggested I do a sleep test. Went, had that done. They suggested that I was quit breathing about 60 times an hour. Got fitted for the CPAP. More or less, they said, hey, to get used to it, start wearing it maybe an hour or two a night. I figured, you know what, I got to wear this the rest of my life. I put it on for the first night for 8 hours and got the best sleep of my life.
Wow, wow.
So, and so did my wife also.
I want to talk a little bit about how your life has changed. Obviously, you're sleeping better, but your overall health.
I feel healthier, more energetic. I do not wake up with headaches like I used to. I'm focused. So 2 o'clock in the afternoon, I'm not thinking of my bed. I am, focused on work or other activities. So it's, dramatically changed my life.
Wow. So the CPAP machine, let's talk a little bit about that. Once the determination was that you were going to have to wear the CPAP machine, how did that work?
Once they determined I had to wear CPAP, it was just brought to my house. It was set up. Pretty much, I put on that night. I thought was very comfortable. There's so many different styles of masks that you can wear. Again, the staff at Wilson Sleep Center, they walked you through the different styles of masks that you can wear. Are you a sleeper on your back? Do you go side to side? How do you sleep? They asked all these questions, and by that they determine what's best for you to wear. I like to move side to side, so my hose moves. Honestly, I can't sleep without it.
Wow. So it's really become a part of your life.
It is a part of me. I went away on vacation, was it 3 months ago, and I forgot my machine, and that was the worst three nights of my life. Again, I woke up with headaches and just
couldn't wait to get home.
Yeah, couldn't wait to get home, put that on.
Put that CPAP back on. Wow. Well, thank you so much for sharing your story.
Thank you.
Thank you for watching this episode of Wake Up with Wilson. Join us next month where we sit down with experts from Wilson Health to discuss important topics when it comes to women and how to live not only a healthy life, but your best life at all ages.